Say goodbye to overwhelming textbooks and hello to vibrant, interconnected mind maps. We welcome you to our new series of videos where we pick each mind map from our mind map bundle and help you run through all the important points you need to remember for your exams. You can browse our app while watching this video and download the mind maps for enhanced retention. So, let's get started. In this mind map, we will quickly revise the various types of hemorrhages, their types and management, and other key points related to blood disorders, transfusion, and shock. First, coming to hemorrhage. It has various classifications. On the basis of the nature of the vessel involved, it can be arterial hemorrhage, venous hemorrhage, or capillary hemorrhage. On the basis of duration of hemorrhage, it is either acute or chronic. Third one depends on the nature of bleeding. It can be external or internal hemorrhage. Lastly, the one that is most important for your competitive exams, depending on the timing of hemorrhage. Primary hemorrhage, which occurs during surgery. Reactionary hemorrhage can occur 6 to 12 hours after surgery, often due to factors like postoperative hypertension, violent sneezing, or coughing. Or secondary hemorrhage, which occurs 5 to 7 days after surgery, typically caused by infection leading to sloughing of vessel wall, for example, bleeding after surgery for hemorrhoids. How does shock occur? The pathophysiology of hemorrhagic shock involves a significant loss of blood volume, typically exceeding 30 to 40% of the total blood volume. This loss of blood volume leads to a decrease in blood pressure and inadequate perfusion of tissues, resulting in hypoperfusion and organ dysfunction. The evolution of hemorrhagic shock can be classified into 4 stages. Stage 1, or compensatory stage, or mild hemorrhage, is the initial stage. The body activates compensatory mechanisms to maintain blood pressure and tissue perfusion. These mechanisms include vasoconstriction, tachycardia, and increased cardiac contractility. There are no signs of hypovolemia. The next stage is stage 2, or decompensatory stage, or moderate shock. As blood loss reaches 15 to 30% of total blood volume, compensatory mechanisms become overwhelmed and adrenaline and noradrenaline are released to cause peripheral vasoconstriction and maintain circulation. Blood pressure drops further and there is a decrease in urine output. Tachycardia persists, thirst is increased, and extremities look pale due to less capillary refill. Stage 3, or irreversible stage, or moderate to severe shock, sets in next. See, when blood volume becomes 30 to 40% of total volume, thready pulse is observed and all symptoms seen in stage 2 worsen. Notably, increased respiratory rate is seen and patients may start getting drowsy. Lastly, stage 4, or severe shock, is seen when blood loss accounts for more than 40% of blood volume. Thready pulse with a rate of more than 120 per minute, extremely low BP, and ashen peripheries are observed. Vital organs such as the liver, kidneys, heart, lungs, and GI system may shut down or get irreparably damaged, which is the most common cause of death. The management of hemorrhagic shock can be categorized as general and specific measures. The general measures taken include immediate hospitalization, airway, breathing, circulation, or ABC maintenance are prioritized. Oxygen masks are given to help with this to conscious patients, and endotracheal intubation is done for unconscious patients. Urgent administration of intravenous isotonic saline, such as normal saline, is crucial to restore blood volume. In severe cases of hemorrhagic shock, blood transfusion is necessary to replenish lost blood and restore adequate oxygen carrying capacity. Routine investigations are performed to ensure the availability of compatible blood products if needed. In addition to the general measures mentioned, now let's take a look at the specific measures, which include pressure and packing to reduce bleeding, positioning of the patient, and tourniquets to reduce loss of blood. Coming to the first one. In case of bleeding from the nose and scalp, packing can be applied using roller gauze, sometimes with the addition of adrenaline to help control the bleeding. Pressure packing can also be used for veins such as the middle thyroid vein during thyroidectomy to apply direct pressure and stop bleeding. The next one, positioning and rest, can help control bleeding in specific situations. The most important example that you need to remember for this is that in procedures like thyroidectomy, an anti-Trendelenburg position, as seen in the illustration, can help reduce venous bleeding. In addition, providing sedation to the patient can help relieve anxiety and promote relaxation, which can be beneficial in managing bleeding. Another specific measure is a tourniquet, which is a device used to temporarily occlude blood flow to a specific area of the body. Two most common types of tourniquets are pneumatic cuff with pressure gauge and rubber bandage. You can take a look at our mind map for the indications, contraindications, and precautions to be taken care of while using a tourniquet and its potential complications. There are surgical methods to control hemorrhages as well, which include application of artery forceps, application of ligature, cauterization or diathermy, application of bone wax, and use of silver clips. Now we come to the next section of our mind map, which are other key points that you should remember about this topic. Blood transfusion is an important component of management of hemorrhage. Blood stored in blood banks can be used for this purpose and should be kept at 4 degrees Celsius plus or minus 2 degrees Celsius. Shelf life of stored blood is 3 weeks, but formed elements undergo changes as are seen here. Factor 8 and 5 levels fall quickly. Acid-base imbalance is another manifestation seen. As you know, they result from a deviation from the normal pH of blood, which is 7.35 to 7.45. These deviations cause acidosis or alkalosis, which are further categorized as respiratory or metabolic. First, talking about respiratory acidosis. It occurs when there is an increase in levels of carbon dioxide in the blood, leading to an increase in plasma hydrogen ion concentration or a decrease in pH. Metabolic acidosis occurs when there is a decrease in the levels of bicarbonate ions in the blood, leading to a decrease in pH. Coming to alkalosis. Respiratory alkalosis occurs when there is a decrease in the levels of carbon dioxide in the blood, resulting in a decrease in plasma hydrogen ion concentration or an increase in pH. Metabolic alkalosis occurs when there is an increase in the levels of bicarbonate ions in the blood, leading to an increase in pH. These acid-base imbalances can have various causes and can affect the body's normal physiological functions. We talked about deviation from normal pH, but what regulates this mechanism? The pH of the body is primarily regulated by two main systems, the respiratory system and the renal system. The respiratory system plays a vital role in regulating pH by controlling the levels of carbon dioxide in the blood. When CO2 levels increase, it stimulates the respiratory center in the medulla of the brain, leading to an increase in respiratory rate and depth. This results in enhanced alveolar ventilation and the elimination of excess CO2 through the lungs, which helps to restore the pH balance. The respiratory response to changes in CO2 levels is rapid. The other one, the renal system, also plays a significant role in maintaining pH homeostasis. The kidneys regulate the levels of bicarbonate ions in the blood. When there is acidosis, the kidneys respond by retaining and synthesizing more bicarbonate ions, which act as a buffer to neutralize excess hydrogen ions. On the other hand, when there is alkalosis, the kidneys eliminate more bicarbonate ions in the urine, helping to decrease the pH. The renal regulation of pH can occur over several hours to days. Another important aspect is fluid and electrolyte imbalance, which is a common observation in patients of shock. To restore this imbalance, total parenteral nutrition TPN or enteral nutrition is used, depending on the state of the patient. Further information about both is mentioned in the mind map, and you can revise it quickly along with going over a few important points on anion gap. With this, we come to the end of this video discussion. Good luck!